So, by mastering these 5 techniques, the buzzwords, the last twists, the honey questions, the art of elimination, and categorizing using the block technique, you can ace your NEET PG exams, you can ace your GT exams like a topper. A warm evening and welcome back to the Animist Setup, your one stop channel for productivity, where I share my exam tips and many strategies which I use to ace my NEET PG exams. So, continuing with the series of strategies, today it's a very special topic we're going to talk about. That is, what are the 5 techniques which you can use in the NEET PG exam for the GTs to solve questions like a topper. So, let's begin with the deep dive onto it. So the first of the techniques we're going to talk about here is the last word and twists. Now this technique is the most important technique. Why? Because it is the most important reason why many of us miss out on the questions. Now, with the changing trend of the NEET PG examinations, it is really important because they're asking long clinical STEM questions. So we often tend to zone out. The only way to prevent this, to prevent zoning out, is to read the last word. Look for the twists, look for the following statements. If they're asking all except, if they're asking which is not true, if they're asking which is not false. So by this technique, if there is a long clinical STEM question, you have to got to look at the last word. What is the last word saying? Is it saying all except? Is it saying not true? Is it saying not false? Along with it, you have to see from which subject is it asking. It may be a clinical based question, but the question is asking for a particular drug or a particular microorganism. Like you were thinking it's a medicine question, but it turns out to be a pharmacology or a microbiology question. So the first and the most important technique in long questions is not two techniques, not to zone out. And number two is look at the last word and search for twists. Now I'm going to show you a practical demonstration of the same. So I'm now going to demonstrate to you the technique, the last twists, and the how to rule out options technique. Okay. So as you can see over here, I've taken this question from UWorld because the NEET PG questions are now coming as a long clinical STEM question. So the first step to solving these questions is not to zone out. Okay. Look at the long question over here. Don't zone out. Look at the last option, the last line. It says a drug from which of the following class is most appropriate for this patient. So now let's see which drug they're talking. This is the pharma question. Okay, so now let's look at the question here. A 5-month-old boy is brought to the clinic by his mother because of a 10-day history of coughing spells. So the first buzzword is coughing spells. He often vomits afterwards. He was delivered at term to a 16-year-old patient. Gravida 1, para 1. Okay. This is a filler question. This is filler part. He's immigrated to the US. Okay. Receives no medications. Not important. Not receive any vaccinations. Okay. Vitals are normal. Okay. Coughs uncontrollably. So the first buzzword is coughs. Okay. Then he has a gasping sound. So that's the second buzzword. There's no nasal flaring. There's no intercostal subcostal retraction. So that actually makes it, it's not a case of severe pneumonia, as you can see over here. Then again, there's no wheeze or crackles are heard. So this, you now know that it's a case of pneumonia in a 5-month-old boy. Pneumonia in a 5-month-old boy. You have been given the clinical findings of no nasal flaring, no intercostal subcostal retractions. What do you think is the answer? So looking at the 5 options, let's try to rule out the answers. Options. The first one, it cannot be fluoroquinolone. Why it cannot be fluoroquinolone? Because the only reason why it cannot be is because it causes cartilage damage. So this cannot be the answer. Okay, let's look at the other options. Why it cannot be sulfonamide? Because sulfonamide, first of all, is not given for respiratory complaints, and the next reason is it can cause jaundice in such a small children because of its exclusive biliary excretion. So this is also not an answer. Looking at the other 3 options which you are left with now, macrolide appears to be the best answer because we have read in all the guidelines, the IMNCI guidelines also, that the first drug just for a simple pneumonia or a cough or cold also, if it is a 5-month-old boy, we give amoxicillin, and that appears to be a good answer. But just let's look at the other option as well. Cephalosporin is given, if you have read the pneumonia guidelines, we give it only in cases of admissions. Okay, if you read the COP 65 scoring system, again you will realize that also that's not due to pneumonia, it's lung conditions only, but we give it in in admitted patients, not in an OPD basis. Okay, and of course penicillin is not the answer. So the correct answer here becomes macrolides, which is the answer. This is how you have to rule out options. This is how you have to rule out options in your exam. Now, looking at the next question, now again, this is a long question. So let's apply the technique of the last word principle. Look at the last line, says which of the following is the most likely cause of the patient's physical findings. You have been given the five diseases. Okay, we have read. Have you read it? Let's see, cystic fibrosis. Okay, थोड़ा थोड़ा पता है मुझे. Hirschsprung disease भी पता है. Hookworm infestation, interception, constipation. Now let's try to find out clues in the question for it. So let's look at the question. A 5-year-old boy, the first hint is it's a 5-year-old boy, pediatric patient, is brought to the emergency department by his mother because of an episode of bloody stool. That's the first buzzword. It is a history of bloody stools. Okay, the mother says that the stool was hard like pebbles. So there's a hard stools and she had bright red blood on the tissues. Okay, the previous bowel movement was 5 days ago. No abdominal rectal pain. Again, these are all fillers. He did have abdominal pain during this bowel movement 5 days ago. So bowel movement pay, but 5 days ago. So right now he has not a problem. This is also important. I'll tell you why this is important right now. Just stay with me. He has no history of major medical illness and receives no medications. Okay. He is having his BMI is at the 50th centile, so he's having some sort of malnutrition. Now comes the important thing: he's having hypoactive bowel sounds, not tender to palpation, 1 centimeter bright red rectal mucosa from the right side of the anus. There's no rectal bleeding. So what do you think? This actually points towards what? This points towards that it is something is causing a prolapse, a rectal prolapse. Now what can cause a rectal prolapse? And it is also causing some features of malabsorption because of the BMI being low, and also there is some sort of obstruction. All these features, you might think कि, अच्छा ये तो 5 year old child है, you think it might be interception, right? But now that is the catch here. Look at the question again. There is no tenderness to palpation, and the abdominal pain history which was there, that was 5 days ago. That was 5 days ago. Okay, currently he's having a hard pebble like condition with a bright red blood on the tissue. So now let's look at the options. Let's look at the options here. So can it be hookworm infestation? No, the first option. Why? Because it will cause anemia. It will cause occult blood loss. It will be anemia like picture. Can it be cystic fibrosis? Again, this is also to be ruled out because it will cause respiratory infections, it will cause the built up of pancreatic secretion. So it can cause malabsorption to some extent, but again, there will be a predominant feature of infections. There will be especially respiratory infections. Along with that, there will be some he mention of sweat chloride test also given in the question. Can it be Hirschsprung disease? Hirschsprung disease is a ganglionosis. There will be a dilatation of the segment. There is no mention of dilatation. They would have mentioned dilatation, or else they would have mentioned they would have mentioned hyperactive movements. Hypoactivity is no point for Hirschsprung disease. So we can rule it out. Now, two options: interception versus constipation. Now the right answer here has to be because of the prime reason told you that just looking at this, don't have a tunnel vision while giving the paper. This is not abdominal pain. The answer here is constipation, and this can be constipation. In this case, can be due to rectal collapse. Okay, can be due to rectal collapse causing a constipation. This is the answer in. Second technique I'm going to talk about is the buzzwords. Look at the buzzwords. Don't be fixated on a single buzzword, and also look at the images and graphs which have been provided in the question, because they are given to aid you. Okay, they're not given to mislead you, they have been given to aid you. This was the scene in this year's NEET PG paper. We had so many image based questions. So now let's look at the buzzword concept with the help of some questions. So again, we have here a question which will help you understand the buzzword concept. Now the question here, again look at the last line first of all. Which of the following is not the most likely cause? So they asked here for not. Okay, which is not. So remember this in mind, which is not the most likely cause. Okay, let's have a look at the question now. So the question says a 46-year-old woman comes to the physician because of a 1 month history of fatigue, weakness, and palpitations. So there are three things, okay? Fatigue, weakness, palpitations, okay? Advanced kidney disease is there, okay? And again, she's using certain loop diuretics, she's using certain beta blockers, she's using CCBs. So you can just note them down, but it's not so much importance. We'll see why. So history of gastritis and hemorrhoids with occult blood in the stools. The first line, because why this is not important, you may ask, because they're not asking you anything about drug based, right? So we'll just look at it. She's using it, okay? She's history of gastritis and has occult blood. So gastritis with hemorrhoids with occult blood, okay? Her temperature is 98.2, so normal temperature, normal pulse, respiration a bit low, but okay. BP is a bit raised, mild epigastric tenderness, okay. 2 plus edema, okay. Cardiac shows S4 gallop. Now when it says S4 gallop, means I am looking at a particular a cardiac output problem or an atrial problem. That is what I'm looking at. I'm looking at an atrial or a cardiac output problem. Okay, let's look ahead. Test of the stool for occult blood is positive. Now this is very very important buzzword which has been given to us. Occult blood. So many buzzwords. S for gallop, occult blood, mid epigastric tenderness. Again they have mentioned occult blood. So now can you see, are these important? Do any of these things, do any of these drug cause it? No, we don't know right now. Okay, let's look at the lab parameters again. We have hemoglobin 8.8, okay, obvious. Hematocrit again bit on the lower end. MCV also lower end, okay. Folate is normal, so that is one thing is being ruled out. What if the folate is normal? That means we don't have a case of megaloblastic anemia, because vitamin B12 can be a cause, but again, if folate is given normal usually, and vitamin B12 will have some neuropathic features as well. So here we can safely rule out the option of this one, splenic sequestration, and of decreased erythropoietin production. Here we can rule out decreased erythropoietin production, because folate and B12 are actually very important players in the erythropoietin production. So this is ruled out because of this simple fact. You can see this is how we are going to play the question. Total iron 60, transfer in saturation is normal. So can you again, transfer in saturation normal, iron also you should know the normal value 5150 also normal. So this rules out iron deficiency anemia as well. So now we are left with three options. We are, and LDH is 62. So what does LDH mean? LDH is a marker for intravascular, extravascular. It's a marker for extravascular hemolysis. LDH is a marker for extravascular hemolysis. So again, can it be intravascular hemolysis? This looks as a possible answer, but let's look at the other options. Can it be bone marrow suppression? Now, in a case of bone marrow suppression, do you think any of this feature, there would have been a patient having pancytopenia, there would have been a patient having pancytopenia, right? This is not such a patient. So pancytopenia picture would be there, there would be picture of infection. This is not the answer. So by choice we have two options left, intravascular versus splenic sequestration. Now in this case this looks again as a possible answer for splenic sequestration, looks a very likely option. But since this is a likely option, we will go for intravascular hemolysis as the final answer. A very difficult question and a bit controversial question which was asked, but again, this is how you're going to come at the right answer. At least you have to take an educated guess between these two options. Let's look at the other question out here now. That is the fourth question we have over here. A 15-year-old boy is brought to the office by his parents to discuss results of a biopsy. So again, what did I do wrong? I started in the first line. First you have to read the last line. Which of the following infectious agents is the most likely underlying cause of this patient's current condition? So they're asking for an infectious agent. Okay, infectious agent. So this is a microbiology question, right? So now let's look at the question again. So a 15-year-old boy is brought to the office by his parents to discuss results of a biopsy done 3 days ago, sorry, for a rapidly enlarging neck mass. He first went to the mass 1 month ago. So the first buzzword here again is it's a rapidly enlarging neck mass. Okay, 2 weeks ago he was evaluated for an episode of prolonged epistaxis. Okay, so it's prolonged epistaxis as well. Okay, and was thought to have a right ear effusion. So many things. Okay, this only gives it away. Let's look at other options also. Height is at the 10th percentile, okay. 50th percentile, BMI 75th, okay, not so important. Right ear effusion and 4 centimeter mass in the right posterior triangle of the neck. This is actually confirmative of the result. In the biopsy also shows a squamous epithelium with indistinct cell margins, enlarged atypical nuclei, and absent keratin formation. So as you can see, these all findings: mass in the posterior triangle of neck, having prolonged epistaxis, having atypical nuclei in indistinct cell margins. This prolonged epistaxis can be a patient of angiofibroma. Why? Because it's a 15-year-old boy. Okay, that can also cause a rapidly enlarging neck mass and can cause ear effusion as well. Okay, if you look at angiofibroma, it has to be a vascular malformation. So again, less likely, because here they are showing squamous epithelium. But what is the other thing which can be associated? It can also cause a squamous cell carcinoma, and SCC, and that is what the patient has over here. So let's look at the options now. Let's look at the options. Can it be HIV? Can it be HIV in this patient? A 15-year-old boy having a rapidly enlarging neck mass, highly unlikely. Okay, can it be human herpes virus, HHV8? HHV8 causes Kaposis, causes Castleman's disease. Again, highly unlikely. Kaposis will have a derma presentation, okay, purplish lesions. Again, highly unlikely over here. So you're left with two options: cytomegalo versus Epstein-Barr virus. The most likely answer over here is Epstein-Barr virus, because of the reason that he is having epistaxis, he's having rapidly enlarging neck mass, and he's also having this right ear effusion, and that is what gives us the answer. So this is how you have to look at the options, how to have to look at the buzz. So the next thing which I will be showing you is the art of elimination, the third point, elimination. So why is elimination important is because elimination is how you actually get the rank. Now, how to eliminate? The first rule of thumb which you have to follow is always go by your gut feeling. That is the first important stuff. Gut feeling or intuition. You know, we often change our answers. We often change our answers. I'm repeating it again because overthinking actually leads to loss of ranks. And the basic reason why people fall out is, even though I've studied, is because of this not following their gut feeling or intuition. So whenever, especially in case of volatile techniques, which my seniors also used to say, for volatile topics, always go by your gut feeling. The first answer is usually the right answer. The next thing which you want to know in the art of elimination is using the guess tracker. Now, many apps like Marrow, Cerebellum, Prep Ladder, Bhatia, they use this guess tracker. Use this tool wisely, because the guess tracker helps you to make an educated guess. Like when you are confused into options, when you are giving the so many GTs, when you are using the guess tracker, and when you are getting a more increased number of responses correct, your likely chances of scoring a correct guess in the real exam increases. And trust me, guesses, no one, not even the topper, also knows the top 20-30 questions in the exam. He also uses an educated guess, and you can do that by using this guess tracker. You have to improve your guessing technique. The third and the most important thing here, which you can also try, is the nota technique. What is the nota technique? The nota technique is, if you are confused between three options A, B, C, and D, what you have to do is pick one of the options which you absolutely have no idea about, and put, instead of the option, put nota. This technique was actually, goes credit to Dr. Bhatia sir at Dr. Bhatia, and he told me this technique. I saw this technique on YouTube as well. So do this technique. It is the nota technique. Put one option as nota and then solve for the three questions. If you're not able to make sense of those three questions, this is definitely your answer. And this, trust me, this technique works wonders, especially in image based questions, like when they give you questions for identifying certain instruments which you have not seen, like percutaneous gastroscopy, or a fracas tube, a nasal jejunal tube, which you don't know about. Rural options, like you know how a Riles tube looks like. Okay, you know how oropharyngeal tubes look like. So you know how a nasopharyngeal tubes looks like. So then the last option has to be the answer. So this is how you, these three techniques you can use to rule out answers and get the correct answer. So the next technique which the toppers use in the to ace their GT exams is the block technique. The block technique to get over a rough patch of questions. Now this is the most disheartening time in any exam, when you get a rough patch of questions. What is a rough patch of questions? A rough patch of questions are around 6 to 7, or maybe for this NEET PG exam even 10 to 15 questions, where you have absolutely no idea what is going on. In that case, what you have to do now, the NEET PG exam is based on blocks and sections. So you have to time your section correctly, right? So the block technique is the technique where you actually inculcate time with questions, because there will be some easy questions as well. There will be easy questions. We are often fixated on the difficult questions. We make silly mistakes. This silly mistake is because of the only one reason is the time management. Now how you manage time? Now roughly if you say 40 questions are there in 42 minutes, this is the pattern for NEET PG. So how you going to manage it is you have to see that your 40 questions are completed by the end of 30 to 35 minutes. That is what you have to see when you are giving the live test. If you don't know a question, if there are 4 or 5 questions you don't know the answer to, don't get disheartened. Just move on. Just skip the question. When you are in a good frame of mind, when you attempt back the question, the chances are high that you will know the correct answer to it. So 30 to 35 minutes you have to give, you have to finish it, and you have to keep at least 5 to 8 minutes for review. That is the most important point. How can you be a master at this? You can be a master at this if you practice enough custom modules. That is the only technique you can do to correct this block technique. The correct use of block technique is go to Marrow, create a custom module block of 40 questions, start a timer of 42 minutes on your phone, on your alarm, anything which you use, and solve the questions in the manner which I have told you. And look, and you'll see even tough questions will seem, patches will seem easy, because when there's a tough patch, there is always an easy thing to pick up in the exam. Now I'll come to the most dreaded fifth part, which is the honey questions. Let's look into it. The honey questions. Now, the first question, what is a honey question? First of all, before I solve you this, is easy looking questions which we make mistake because of a PYQ bias. I'll tell you how this happens now. Let's look at the first question over here. The first question over here is, what is the dose of BCG given within 24 hours of birth? Now, the questions will not come just a single line, but there will be a long question. But the question was this. The last line which the question mentioned was, what is the dose of BCG given to a newborn within 24 hours of birth? Now, if you are not vigilant enough, you just read it that अच्छा हम लोग 0.1 ml intradermal injection देते हैं. But guys, this is for more than 1 years. If you look at it carefully, the question is within 24 hours of birth. The right answer is 0.05 ml intradermal injection. And this is where the examiner traps you and you get the question wrong, thinking, अच्छा ये तो मैंने पढ़ा था, right? So this is a PYQ bias. Don't fall in the trap of PYQ bias. When you are giving the exam, go without any PYQ bias. We do PYQs, but do not have this notion कि अगर ये क्वेश्चन आया है ये तो PYQ था, यही आंसर होगा. वो आंसर नहीं होता है. Let's look at this another question over here. What is the full form of JSSK? JSSK, इसका लोगो इस साल के नीट पीजी एग्जाम में आया था। JSSK, व्हाट इज द फुल फॉर्म ऑफ JSSK गाइस? जननी स्वास्थ्य सुरक्षा कार्यक्रम, जननी शिशु सहायता कार्यक्रम, जननी शिशु सुरक्षा कार्यक्रम, जननी सुरक्षित सहायक कार्यक्रम। So what do you think is the answer? The answer is Janani Sishu Suraksha Karyakram. Now why this is a honey question is because if you are not careful enough, if you are not calm enough, you will mark the wrong answer saying अच्छा जननी, अच्छा सुरक्षा, अच्छा यही है स्वास्थ्य सुरक्षा कार्यक्रम है. You won't read this stuff and the examiner knows that, he knows the trappers. Therefore these are the honey questions. Tackle the question. The way to tackle honey questions is be calm, be composed, and give exams without a PYQ bias. Give any GT without a PYQ bias. So thank you all for watching the video till the end. And if you have liked my content, please like, share, and subscribe. And it will mean tons of me to get all your love and affection. And please write in the comment box how can I improve and where and what content you want to see more. Thank you, and we'll be coming back with the next video soon enough. See you soon. Bye.